This is Kumari Surabhi. Here I am going to do complete motor testing of the upper extremity as well lower extremity. Introduce yourself to your patient. Confirm patient details with your patient and explain procedure. Gain consent from your patient. With patient health history in mind and after good hand hygiene, ready for the examination. Assessment for upper extremity. Look for atrophy. Atrophy of hand muscle normally occur with aging. Pay special attention to hands, shoulders and thighs. Evaluate the patient muscle tone or resistance to passive stretch. Take one hand in yours and while supporting elbow flex and extend patient fingers, wrist, elbow and put the shoulder through a moderate range of motion. Its side, note muscle tone, the resistance offered to your movements. In muscle testing, the patient resists and the examiner overcomes the patient resistance. Begin by testing flexion of the biceps muscles. Ask patient to bend arm at the elbow and pull against your hand. Extensions of the triceps by having the patient push against your hands. Flexion of the patient wrist and extension of the patient wrist. Test the patient hand grip. Check muscle strength by asking the patient to turn palm down and spread fingers. Check abduction by trying to force them together. Test a position of the thumb by asking to patient to try to touch the tip of little finger while resist the movement. Assessment of lower extremity. Motor system examination of lower extremity is best performed with the patient lying supine. Flexion of hip. Place hand on the patient's thigh and ask patient to raise legs against your hand. Hip extension by gluteus maximus by placing your hand on the posterior thigh and providing resistance. Hip abduction by gluteus medius and gluteus minimus. Place your hand firmly on the table outside the patient knee. Ask patient to spread both legs. To test hip adaptors, place your hands between the patient's knees and ask the patient to bring knees together. Continue by testing muscle strength at the knee by supporting patient knee flexion and asking patient to straighten the leg against your hand. Dorsiflexion at the ankle by asking the patient to pull up against your hand. Plantar flexion by asking the patient to push down against your hand.